Welcome to this week's episode of Surgeon Interrupted. We're thrilled to have you back here, and we have a very fun guest for you. Abhilasha joins me, and she's going to be talking to us about really like this new standard, I think, for role models for young doctors who are applying in the match, going into residency, but also not making their identities really like one note just to fit into medicine. We love it. We love to see it. I definitely believe in really giving people as many role models as possible in this space. And so thank you so much for joining me here today and taking the time.
Thank you so much for having me today.
So, as a quick intro and just so that everyone can know a little bit about you and your journey, can you share with us where you're at in terms of your journey towards medicine and towards residency?
Of course. So my name is Abhilasha, and I'm an international medical graduate. I have been doing research for the past 2 years at Duke. I finished my medical school in India, and that was back in 2023. So I've been in the US for the past 2 years ever since I graduated, and it's been an amazing experience. Currently, I work at Duke GI. My research is in hepatology specifically, and
Mm-hmm.
I'm applying for this year's match, the residency match for this year. So fingers crossed, I am in residency by July this year, hopefully.
That's such an
But
exciting time.
yes, it is. It's really an exciting time. So it's been a while, and I really want to get started on my medicine journey. And I'm
Sure,
done with
yeah,
baby
like,
steps.
yep,
So
that makes sense. Like back into clinical
yeah,
after
definitely. I
research
miss I
years.
miss being back in the hospital. I'm kind of like a little tired of research and I kind of want to go back. So it's definitely exciting. And I have people like you to, look forward to. I see a lot of, your videos and it's definitely interesting. And this is my first podcast. So feel free to like tell me anything ask me any questions and
Yeah,
maybe we can go through it. But it's going to be
absolutely.
exciting.
No, I think that that's great. And yeah, I mean, let's start there because I have shared some and again, I'm so far past. I wasn't attending for a few years. I'm in my 30s. I do feel like, and again, being in your 30s, to be fair to all of us, that's still young. I'm not saying that's washed up. I am just saying that my journey in medicine like and surgery really did a little bit of a number on me. And so it's even hard for me to recognize the person that I was when I was a medical student and I
Mm-hmm.
was modeling. Like I was signed to a modeling agency and I loved it and I did gigs when I could, kind of like around rotation times and outside of regular hours and it was a wonderful experience. But the thing is that that was a long time ago. So I'm trying to think back that would have been like 2015, 2016,
That's not
maybe a
that
little bit
long ago.
2014.
You look so young. Like, what are you talking about? I was like, she's talking about being old. I'm like, who's old? Who's the old person here? Is
Well,
the old person in the room with us? Because I don't see her.
that's
But
so
okay.
sweet. I will say to my credit, like this past year, I think, especially the past 6 months, like I got years back on my life. I do not look the same way that I looked even a year ago. I definitely think I kind of got like even from like all the chronic stress and cortisol. I mean, my face shape is different and I'm grateful. I'm lucky to have like de-aged somewhat. Just take my word for it. I'm not going to show you pics of me like in residency or at the end of training or anything like that.
I'm just
But
gonna take your word for it at this point.
so I do think, and yeah, in some ways it was a long time ago, in some ways it wasn't, but like in 2015, basically we came to the point where I approached one of my mentors at my home institution and I said, should this even be anywhere on my ENT application or should we literally just like keep it on the DL? Totally fine. We could have like it wasn't like I was such a prolific commercial model that like, oh, this is going to come out one way or the other. Like they're going to see you on Times Square. It became this real decision, like a branching point of maybe we just leave it off.
Mm-hmm.
And it's interesting because my female mentor at the time, who I so looked up, she's amazing, like great doctor, great person.
Mm-hmm.
But I think it's interesting because I almost wonder what a male ENT mentor would have said to me. Maybe his answer would have been different. She ultimately said, I think it's awesome. I think it's cool. It's honest work. You were paid to you made a little money off of it, and you probably have some stories about it. And honestly, it's even a skill set. So I think you should put it on, just put it under hobbies. It was like a small thing. And we went ahead that way. But I did get, honestly, more than one mean question about it on the interview trail. And
Yeah,
that
that's
sucked.
I know that sucks. That's so mean. Okay.
Yeah, I mean, well, and in ENT, I had some facial plastics people specifically be like, that's crazy. And I've
Well,
had
did you get
since
anything
then,
done? Were they asking you questions like that?
yeah, I mean, even since then, I've had facial plastics guys tell me, "Oh, one of your eyes is like a millimeter lower than your other one." Like,
Oh yeah,
and I was not asking. Like people,
unprompted.
yeah, don't give that. If someone, sure, they might be asking for it. I would never go up to someone and be like, "Hey, if you could do any number of surgeries on me, like what all would you do to fix this?" I'm not that type of person. I've heard people say that before, but I wasn't. And he just was like, "Anyway, one of your eyes is like lower than the other," and it haunted me for all the years since. So, I guess I just share all that background and context because what I'd love to hear is really like, what is it like now? And what I love, and to share with everyone for background, of course, we're going to link your accounts like in our show notes, but I feel like I first came across, your page and everything because you were killing it. You're out here, you're modeling. I think you have a really great brand that just shows, both sides of it because, yeah, it shows medicine research, right? Like all the really hard work that anyone would put in to get here. But then it also shows this really like vibrant life outside of the hospital.
Definitely. So I think like I was always doing modeling back when I was in India as well. I grew up, both my parents are Air Force officers. So
Hmm.
I grew up in a defense family in India. And I was like, my parents were like, no, don't do modeling, just focus on your studies. They were the proper South Asian parents. They were like,
Right.
this is not going to do anything for you. And I grew up actually not that good looking of a kid. Exactly what you had like happened to me when I was like maybe 12 years old, where this one plastic surgeon was on vacation and he was there in the same place as us, and he turned to my mom and he's like, would you ever think about giving her a rhinoplasty? And I was like maybe 14, 15 at the time. And, he said that
No.
to me. And I was like, and my mom was always like, don't smile, your nose is really big and don't do this. And I was like, okay, fine. So I grew up, hating myself a lot. And I always thought I wasn't like the prettiest person in the room. And never thought of going into modeling or anything of that sort. And then I joined med school, and of course, med school. Med school is so hectic, and in India, it's a little different from you guys. We joined med school immediately after high school,
Mm-hmm.
so I was like 18 and going through it. We didn't have a life, much of it, and I started taking pictures, and that's where I saw okay, my followers increase, and then I was like, I started getting like brand deals back in India, and then of course, when I came to the US, I took a year of, like studying for step two and I had like an anaphylactic shock. So I completely understand. I had an
Oh my
anaphylactic
gosh.
shock like a day before my step two. So I broke out into hives. I had the entire, like, the cortisol phase because I was on
Oh my
such high
gosh. May I
corticosteroids.
ask, what was it to? What was the reaction to?
So
Do we know?
initially, we didn't know. Initially, we didn't know what it was from. But then I actually did my own, like, did my own
Mm-hmm.
analysis of what I think it could have been. And at the time, my now fiance had gifted me like some laser treatment for my face. He was like, why don't you get it done? And it'll be not
Mm-hmm.
hair removal, but just like skin treatment.
Yep.
And that time I think the dermatologist that I went to, she wasn't consulted, but the esthetician or maybe I guess the nurse practitioner there, she recommended I take minocycline because I had mild acne, which is kind of normal because your skin is purging. And that minocycline, I told her, hey, I'm allergic to doxy. I know I'm allergic to doxycycline. It causes like,
Oh,
it
I
causes me like
gotcha.
a severe acid reflux. I don't want to take doxy because I have my exam coming up. So she was like, so people who don't want to take doxy, take minocycline. And I was like, okay, I can try this maybe like, and I tried it. And initially nothing happened. So I was like, oh, I'm fine. Like, let me just finish my course because I'm a doctor. I can't just, not finish my course. So I finished my course. And I guess 2 days after I finished my course and a day before my step two, I had this like my neck just started swelling, the back of my neck. And then it just like it would not go down. I kept taking cetirizine. I think I might have taken 20 cetirizines that day because I was so
Oh my
scared.
gosh. Yeah, that's terrifying. Oh,
And then
I'm
like,
sorry. Of course, right before the
yeah, it's
test.
okay. It's fine. I mean, you get over it. It's fine.
I mean, yeah, what a way to be introduced from the patient perspective to the US
Yeah,
healthcare system.
and
And
I was like
again,
shocked. So I ran to the nearest family medicine physician because I was like, like I'm scared and this is the only place I know that immediately they can give me the medication without me having to wait in an
mhm,
ER. So
right.
I just went in. I was the first appointment in the morning. I was like, you have to see me. And by then I could start feeling like my breathing difficulties were getting worse. So I turned to him and I said, just please just give me like I just need an
Mhm.
EpiPen right now.
Yep,
And he gave me the EpiPen, he gave me a corticosteroid shot, and then I took it orally. But yeah, it was definitely an experience. So this year I started again. I started proper modeling again, and I have had a really supportive community here down in Raleigh because my friends, like
that's
a lot of
awesome.
people who are amazing, a lot of people I look up to, a lot of models and a lot of photographers I've had the opportunity to work with. And funnily, most of them are women. So
Mhm,
it's really
wonderful. Well,
interesting.
may I ask, are any of them in medicine or just like
No, I'm
none?
the only
No,
one.
yeah, you're
I'm
the
the
only
only do
one. Yeah,
It's
it's
really
hard.
weird, yeah. Because like, people introduce me and they're like, "Oh, you know what? She's a model and a doctor. She's so." I'm like, "Yeah, but it's not the easiest thing sometimes because, I know maybe when I do get into residency, I'm not gonna be able to pursue this, so I'm making the most of this year that every this is funnily I've had 3 interviews already these 2 weeks, and everybody has said the same thing. They're like, make the most of this time. And as you mentioned, when I saw the video of you today talking about how you mentioned in your hobbies, I've actually mentioned it in my hobbies as well now. And
Yes. And how's that received? Like, yeah, I'd love to know. Like, break it down for us. Because here's what I would say too: is I assume that like depending on what are you interviewing for, and who's reading it, it might be received differently. They might be like, "This is the coolest thing ever," versus
I know,
not
like,
understanding.
like, I didn't have a mentor like you to go through my eras and stuff with me because
Hmm.
I'm very like, I don't like a lot of criticism. I'm very criticism averse sometimes when it comes to my, like, I'm sure everybody
Oh, me
has their
too.
own thing. Yeah,
No,
I'm
I
like,
am too.
I start freaking out. I'm like, no. But so this time when so I didn't do it last time. So this is the year I did it. So
Hmm.
I was like, let me just include it. It'll be like a nice, fun fact. Um, I had, I think, only one assistant program director ask me about it recently. And of course, I'm not applying to ENT, I'm applying to family medicine. So it's a little different. I've heard, like, I don't want to be mean, but I've heard different things about surgeons in the US
Oh
and
my
different things
gosh.
about
Yeah, you're not
physicians.
telling me anything I don't know. Yeah, I think family medicine, many of my friends, at least in family medicine, they tell me that their experiences were very positive in training, which I think is lovely. And they say, like, we were encouraged to have hobbies, have other pursuits, have artistic pursuits, the type of work that you do. So,
So,
yes, absolutely. I corroborate what you're saying.
yeah.
You guys know, any of our listeners know how I feel about surgeons, and they can be quite judgmental and ornery. So yeah, please continue.
So, like, I think, like, one thing I remember back in med school, funnily, was my anatomy teacher pulling me aside in my first year and asking me to deactivate my Instagram. Because she told me, she was like, either change your name or deactivate it or do something because it's going to ruin your career. And I was like, why? It's just my Instagram. And I didn't even post
Whoa.
much back then. So I just had a lot of followers that didn't post much back then. So I was like, why does it matter if, if I do make it or don't make it? Like, it shouldn't matter to anybody what I'm doing in my personal time as long as, and I was a distinction student. So I was like, okay, I don't
Yeah,
understand
when you're a
why.
good student. Yeah.
So when I came to the US, as I was saying, like during my interview, an assistant program director did ask me about it. He asked me, so you do modeling, can you tell me more about it? And I was like, I told him how I worked recently, funnily, with this brand called World Class, which is basically a brand that was started with two colon cancer survivors. And it's a very
Wow.
interesting brand. Like, it's the women who run it are like, they are amazing role models. Like, they actually had colon cancer and they actually advocate for survey, like, doing
Mhm.
proper colonoscopies and
Mhm.
surveillances, which is so rare. Like, a lot of
How
people,
old are they?
I think they're in their 40s or maybe 30s, late 30s and 40s, but they don't look
They're
it.
that
So
young?
I could be wrong. They
No.
could definitely be way younger. I'm sorry, Sarah, and I'm sorry,
No,
Brooks.
no, it's
I
just
do not
it's
know how old you
scary.
guys are, but you look really young. Heads up. But
Yes,
either
yes, but I
way,
just more mean the epidemic of colon cancer in younger people
yeah,
is,
it
of
is.
course, terrifying for all of us.
That's actually why I was very interested in GI because when I first came to the US, I wanted to do gastroenterology, and I was like, because I know I see it in real time. Like, I feel like that's going to be the next epidemic for our generation because everybody has IBS, right? I have IBS on some days. Like, if you like today, I was like nervous. I was like, oh, I'm nervous today, and I didn't eat anything. But when the assistant program director did ask me, I told him about this brand I work with. I told him about how the money from this brand actually goes in to paying for colonoscopies for uninsured people, and by the way, the brand itself is insanely good. Like the quality of the clothes is so good. I actually
Mm,
wear their sweatpants all the time. And I love I'm gonna buy their shirt and probably their cap
I
for
have to check it
gifting it.
out.
You should check it
Yeah,
out.
this is
It's really
great.
fun. And I love the motto of the brand. It's like, a great ass is, if you don't use your great ass, it's a waste of time. So it's a waste of
Yeah,
don't waste your great
uh,
ass,
I
basically.
always say
I might
that.
be butchering it right now because I'm nervous,
Amazing.
but let me just read it out because I want to read that out. That's kind of mean if I don't know the brand's thing, but they are amazing. They're a great brand. And when I told him about this, it kind of pushed the narrative into wow, okay, so you're doing like social work and you're
Mhm,
doing like modeling. It doesn't just have to be one thing, right? And I also think maybe like I've noticed that women are more open to the idea of having models and stuff. I don't, maybe like sometimes, luckily, maybe I've not met the judgmental men yet, but I have met a few like a lot of judgmental men in my medical career in India, where they openly like were like, oh, you think you're all that, stuff like that. I've had that happen. Yeah, they've
like, from your peers or from, like, educators,
both,
like, older
both.
people?
Both. Like I've had people taunt me sometimes as well, like, oh, now you're a model, or like sometimes. So I am somebody who likes to separate my lives. I do not like I'm somebody who I will not speak about things till I don't achieve them. That's just who I am as a person. And like if you ask me about research, getting into research at Duke, I can maybe tell you about that because I've done it. I can't tell
Mhm,
you about residency because I haven't done it yet. And
mhm.
I can talk about all of this, but it's not going to make any sense to anybody else because they're going to be like, you're not you're not I can't give out advice that I've not done and achieved myself. But I do plan on making my account a little more medicine friendly once I do match.
Mhm,
But I have noticed that because I don't talk a lot about medicine in my own profile right now, and I like to keep that to myself.
mhm.
I believe in the evil eye. I know that sounds wrong, but
Yeah,
I do.
ditto, honestly. No, absolutely. It makes sense to me.
So I definitely believe in that. And I think a lot of people forget that I'm a doctor as well sometimes until they fall sick. And then I have friends messaging me, hey, this is what's happening to me. What do you think I should do? This pill didn't work. It's
I do I think that that's a compliment, though. Like, genuinely, just truly, like, I guess let me back up and say it this way. Big picture, when I think of, like, physicians that I know who do a really good job. Like
Mhm.
I marvel at their clinical skills, but also like their bedside manner, their interpersonal skills. Like I just really like love how they show up to the hospital. What's really interesting is I do think I'm running through my mind right now, but I think 99 to 100% of the time, if you caught that person in a different context, they would still be lovely and likable, and it wouldn't immediately have to be like, oh, they're a doctor. The fact that they can exist those other ways. Like I'm saying, you might run into them
Yeah.
like at the winery and they're just like a cool person and they're going to tell you about how they fly planes as a hobby or woodwork as a hobby, right? Like things like that.
I know.
I
It's
just,
just like, it's insane because I just feel like sometimes, like, a lot of people assume that just because you're a doctor, your entire life has to be about medicine. And that's not how, like, everybody has hobbies. Modeling is a hobby too. And it's something, I mean, of course, it's a job, but it's also something people do for fun. It's also, it's like photography. It's like
yeah.
tending to plants. I just feel like it should not be looked down upon because, sometimes people are like, oh, aren't you really full of yourself, constantly posting? That's my brand. My brand is my face. So what do I do now? Like, like it's just really mean sometimes. Sometimes people are mean about it, where when I do post one or two things, like, when I posted my step 3 passing and everybody was like, finally, you're actually doing something that you went there to do. And I was like, okay, I
Yeah,
just don't tell you about what I do every day, but
the judgment is tough. Yeah, I'm just, it's a bummer. I'm sorry that you deal with that. Obviously, it sounds like you have good perspective on it. And so, like, the haters, they just, they're in one ear, out the other is probably a good approach there. But what's funny is I don't feel like all doctors have hobbies. And again, I don't say
yeah,
that judgmentally. When I was like in the rigors of my training and practice, like I lost all my hobbies, and I really, like, I think I probably wasn't that fun to be around in any other context, because like I would go to a party or go to a dinner, right? And just be kind of like talking about work in the hospital the whole time. As some people can fall into that trap, and like that's not good for any of us. It's not good for us. It's not good for our like dinner partners, because then they have to listen to the same like kind of boring things over and over again. So what's funny though, I just almost feel like the people without any hobbies, they're trying to stamp out the hobbies of people who have them. And
true.
so
Like,
what we want to do, certainly your generation and beyond, is like flip that on its head to where the norm is.
first of all, I think we're the same generation, girl. You need to stop
No,
saying that.
no. Oh my gosh, I think you're younger. You're younger and more promising than me, but I think that this is how it changes, right? We just need like a little bit more public discourse and momentum. And then 5 years from now, when women who also model as part of the whole package that they bring to the table, it's like a plus. People are like, that's great. Like, I love that, because that means that they have an appreciation for X, Y, and Z in the arts. They have these other skills that,
Yeah,
some of
definitely.
our.
I think definitely it's medicine sometimes like has a very conventional approach, like, how the mentors are, teachers are, faculty usually is. They're like, no, how we did it was this way. So you should do it this way. And that's a lot of grandfathering in when it comes to medicine, like I remember when I was in India, we like this is a habit I have now, but we were never allowed to paint our nails in med school. We were never even allowed to have nails, first of all, let alone pet our nail, like paint it or do anything with it. Always tied up hair. So when I came to the US, I was like, oh, this is a much better working environment. At least people are allowed to have nails. Although I've never seen doctors have nails again, like proper nails and stuff. So um I think like I have been lucky in that on Instagram I found like a bunch of other people. So I think one of them is like, I don't know if you know her. Her name is like Mahita, and she's a dancing like her username is Dancing Euro Dog.
Dancing Eurodoc, Mahitha.
Yeah,
We love
yeah.
her. We're Mahitha Stan. She works with us at the Hippocratic Collective. So
Whoa. Okay.
literally,
Wow.
yeah,
Okay.
I
Wait.
love her.
I want to be a part of this organization. So maybe after this, I can see the signing up to it. She's amazing. There's this other, I think she's a med student. Her name is Simran, I think, SimCity. She
Mm,
is, she talks a lot about this. I think I follow her, and we've only talked a few times, but I wish I could maybe get to know her a little better after this. But she talks about not just having like,
that's
med school,
amazing.
not making med school your life, basically.
Well, yeah, exactly. And again, like, I think that what people kind of get backwards is that when I've seen like what you're describing in this scope of like women who are doing X or Y or Z, we'll use Mahitha. Again, I love her. She's our artist in residence. Her dancing, artistry, and her work, it is very moving. I've seen it for years, right? What people don't get, because I feel like sometimes they look at that and they're like, oh, you're not serious, or you're not putting enough time. I will always make the argument and stand like 10 toes down on Mahita must be extraordinary at her job. And again, I know her, so I can cheat with insider info and say she's extraordinary at her job. You actually have to be really, really good. You have to be competent, skilled, and then you have this little bit of extra bandwidth to dabble in X and Y and Z. And that's what people are seeing when they see that. But it's so funny how much they can miss the point and be dismissive of like, okay, well, whatever, you're not a serious person. They're actually probably an uber serious person who is able to juggle. multiple skills at once in that fashion.
True, because like I think like one thing I've realized is that we all have 24 hours in a day. It's about what you want to prioritize, and you don't even know um that maybe this hobby could be what's preventing burnout. Maybe this hobby is what's keeping that person afloat, is what's, maybe helping them redirect all this energy from medicine into something more productive. Because sometimes you're just so tired and you don't want to do things, and it's so easy to just lie down and be like, you know what, and I learned that from my partner. My partner,
Mhm.
he was a marine, and now he works like two jobs, and he will make the gym a priority every day. This man, like, he does physical labor, does morning labor, does his morning job. It's work from home. Then he goes and does physical labor, which is his second job. He still comes back. And I remember days when I'm home all day and I'm tired and I'm like, I don't want to go to the gym. But I feel so bad because he prioritizes the gym so much that I'm like, you know what? This is my motivation. I need to get up. I need to get going. I can't just be sitting here. And when you sit there, time flies by, right? You can always be like, oh, I want to be the most productive person in this, in my program or whatever you want to do on that particular day. But productivity is also knowing how to take out time for yourself and doing what you love. I mean, it could be different for you, it could be different for the other person, but sometimes that productive, that 1 minute, that half an hour, that 1 hour saves you from burnout, saves you from, just sitting and moping all day. Because sometimes, like, I'm seeing right now, when I was in my when I was seeing my residency interviews, like, the invites that we get, and they
Mhm.
have these Reddit threads. I'm sure you must have been through it in your time
Sure.
now. So
Mhm.
we have that, and there's people like moping around and being like, "Oh, I only got 10 interviews," and I'm like, "Okay." But it puts things into perspective because I have things to look forward to now. I know that, hey, next week I have something to look forward to. I'm meeting this new person. And also, modeling isn't just taking pictures, it's meeting somebody new, it's talking to them, finding out how they work. And I've met amazing people through it, like so many photographers, Madison, and like all of these amazing people that I would never have met had I been in medicine. And it's such a relief to, meet people who aren't just talking about patients and diseases.
Yeah,
Right.
absolutely. No, I think that we are just, like, much better off the more that we have those conversations with everyone, and, like, honestly, I mean, right, that is quite literally, I think, part of a core skill of being a physician because our patients are often going to be, like, varied populations, and I just think that ability to, like, walk into the room and be comfortable and be at ease and put the other person at ease. I want to live in a world where every single doctor has that skill. And one thing that I think is helpful is even the type of work that you're describing. Absolutely. You probably pretty early on, that's one of the first things you need to be able to do, right? Show up to a gig, show up to a photo shoot, show up to a room with new people, be at ease, put everybody else in the room at ease. That's an underrated skill, perhaps, in medicine.
It's also like very interesting because people don't realize sometimes modeling requires you to adapt really fast to things. It requires you to actually use your brain to be able to, think of a pose on the dot, think of things on the dot, be there on time. It teaches you how to, work in like stressful situations because not everything goes as per plan, even though you plan and shoots, right? And I think that bringing that energy back into my residency is how I worded when they asked me the question like, hey, what do you think, like how do you think like this modeling is going to help you out into when you how you're going to like apply those values
Mhm.
back into medicine and into residency. And I was talking about one of my answers is this. It's the fact that I require to be there on time. I work with somebody else. I require to be adaptable and I require to be prepared for things that I bring into when I do practice my medicine, when I do practice residency, and when I do become a part of these people's program because it's important. These are important things that every doctor should know.
Mhm.
And of course, we already know, but um, as you said, being personable, being somebody
Yeah.
that people feel approachable, being approachable too. Because sometimes
Yeah.
doctors, I feel like there's this misconception about doctors that all over the world that we are not approachable people. I mean, I understand
Yeah,
completely.
I mean, and that's the thing. And again, like no no judgment. I always say the disclaimer of like I'm talking about me then. I'll say from experience. Like, yeah, when I was younger and when I was like a budding surgeon and I was becoming a surgeon, I wanted to be intimidating. I was like, I'm great. Like don't even try me. Like I wanted to be intimidating. And where did I learn that? I learned that from all of the surgeons who were modeling that. And like that's just how we kind of came up in the system. But I totally agree with and love what you said. I mean, I just think that this is all part of the bigger conversation of like the culture of medicine, the culture of surgery, because I did not get that. I did not make that up myself. This idea of like the aloof, really intimidating, really inaccessible doctor and surgeon. I did not make that up in a vacuum. And a lot of people still cling to that. But I think that we can just ask for more and do better. Like it probably would just be a win-win-win, both for everyone who works in the hospital and for our patients and us as people, if we choose to like actively shed a little bit of that ivory tower. I'm going to scare you. I'm much better than you, and you have to respect me, and we're going to buy into the hierarchy type thinking.
No, definitely. Because, like, funnily, most of the doctors, like, I've been very fortunate at Duke. And
Mm-hmm.
outside of it, like, I've had my fair share of really mean people. Somebody that I can recall was one of my rotations that I did, and he was very weird and he refused to give me a letter of recommendation literally a week before my application submission deadline. Um,
Oh,
Even though like everything was perfect, everything was fine. I took constructive criticism every, 3-4 days from him. And then I went on to the the funniest thing is I went on to these lists that they have on Reddit about malignant programs, and funnily this program showed up in that list, and I was like, oh, but it feels bad because I wasted a whole month. I went there for a month
sure.
all the way to this place, and then this one person can mess with my career so badly. Like I didn't even think of it in that way. But then I also met like such amazing doctors here at Duke. One of the doctors that I work with, he doesn't even call himself a doctor. And he's so approachable, Dr. Wilder. He's amazing. Like you can just go up to him and just talk to him and tell him your problems, and he never judges you. And this person has done everything from Duke. Like he is a
Yeah,
transplant
amazing.
hepatologist, or like, and it's insane. So I've met such amazing doctors, and then I've met doctors I don't want to be like. And one more thing
Yes.
I want to add is like, one thing I don't like, especially like, maybe this is all over the world, I guess, but like, I see a lot of like, healthcare providers, advanced healthcare providers have lives of their own, hobbies of their own. Like, I
Mm-hmm.
saw like recently there was this nurse who's a backup dancer for people on tours. I'm sure
Wow.
like, Love Island, like, I
Yeah,
mean, if you've seen Love Island, what was his name? Nick. He's a nurse too. So I was
I
like,
love that.
he was a nurse and he's on the show, and I was like, see, now nobody's thinking about how he's not going to be able to give proper care, right? But
Right.
you never see a doctor on any. I mean, of course, it makes sense because you don't have time, but still, you never see a doctor, and it's also like, why is this thing on? Like, why is this mentality only fixated on us? You know,
Well, I
why is
think that probably by design, though. I mean, I think that doctors have said for decades and generations that they are on a pedestal. Like
yeah,
again, I
that's
think that
that's
it
right as
is
well.
that way. And so, but I agree with you because I actually think that bad things can also come from being put on a pedestal. So that's what's tricky about it. Like I totally get it. Obviously, enormous responsibility. I do personally believe that it's crucial, sacred work that the doctor does. But in terms of some of this putting it on a pedestal, they are higher than you, they're above you, that's where I think we get into trouble, we get into problems, we get people treating each other badly. Because the implication is if somebody's on a pedestal, that means somebody's lower. And I just don't buy into that. I think that's where a lot of the pain points come in culturally.
Yeah, I
The other
mean,
thing I
yeah.
want
Go
the
ahead.
other thing I want to mention really quickly is just when you talk about like Dr. Wilder, I love that. I think that you put it the best way where people like Dr. Wilder, I personally even went into medicine because I did meet mentors like that. Like absolutely, just those doctors who they're just cool, they can just cut up with you, they're nice people, they work hard, they care about their patients. I actually think all of us who have gone into medicine, like, can think of those people. Because if I had only met jerks, I probably wouldn't have done it. I really don't think I would have. But, like, absolutely, I had these people to look up to, and so I decided to apply and things like that. But I just still think that what you said is then I have these doctors where I say, "Okay, I don't wanna be like you when I am practicing." And the way that I just show up to rooms and maybe interact with the world, and I really experience that too, but I hope that the tides kind of turn, like, I want there to be more of that, like, congenial, really approachable, again, still kind, often even more brilliant doctor, and then we just don't accept some of, like, the really more malignant personality types. Because right now, we just, like, still accept it. If someone has a really malignant personality type, people will be like, "Oh, well, they get a lot of RVUs."
I think, yeah, I think maybe like, I think there's definitely a shift right now, maybe, at least as far as I know. As far as I'm seeing, of course, when I join medicine, it'll be a little more. When I join residency, I think it'll
Mhm.
be, my views might change. I don't know. And every program has, their bad apples and their good apples. And you just have to like tread carefully around the bad apples, I guess.
Yeah, yeah.
No,
No workplace is perfect in or out of medicine, so definitely, I think you have a very healthy perspective. I so appreciate you joining me here today.
of course.
I'd love to hear if you have any parting wisdom for us, but, it's such an interesting crossroads of your professional life right now. I really appreciate the intersection of, like, your modeling your art plus medicine that you've shared with us today.
Thank you so much. Parting wisdom would just be make time for yourself. Only you can care about yourself, not your mom, dad, not your mentors, not your attendings. It's you. Um, and how you want to make time for yourself and how you want to show up for yourself matters, I think, a lot more than um there's this like funny joke that people say that when you get fired from a job, they replace you immediately, and that's when you should realize that, hey, you're very replaceable. Um, and of course, work on your body, work on your like a good healthy body is what makes a good healthy mind. Take time for yourself and definitely do what you love because people will talk either way. They're gonna talk. Everybody's gonna talk about you and about anybody else, but as long as you are doing what's true to you, that's all that matters. And the universe will find a way to work around you and make sure that you get what you want as well. So this is something that I don't know if I rounded it up properly.
No, perfect. Beautifully said. That's really beautifully said. People really will talk either way and, like, give them something good to talk about. And they're talking because they aren't doing it themselves. They aren't doing anything. You
I
know,
think like yeah, like I think for me personally, when people like hate on me, I find it like still stalk me to this day. People that I haven't talked to for years, and it drives me even more. I'm like, you still care about me, you still care about what I'm doing, and I feel more badass the fact that I can do both. Like, can you imagine like somebody that can do both? Why not? Why wouldn't you
it's
want to do both?
the new Taylor Swift song, Actually Romantic, is
Oh,
exactly about that. Like, just you're still talking about me after all this time. It's actually kind of romantic. Okay,
yeah, it
well,
is.
beautiful. Thank you so much for being here with me today. It's a privilege to get to chat with you and certainly wish you the best during this application season.
Fingers crossed. But
We're
thank you so
going,
much.
yeah, sorry, go ahead.
Oh no, I was just saying thank you so much, and I had such an amazing experience today. A great ass is a terrible thing to waste. That's the colonoscopy. I just remembered it right now.
I
That
love
was
it.
what world class's brand was. A great ass is a terrible thing to waste. But yeah,
Uh, Truer words have maybe never been spoken. So that's wonderful. Thank you so much for
thank
being
you
here.
so
We'll
much.
absolutely, you will link, your account in the show notes and everything so that people can check out the work that you're doing and follow your journey.
Thank you so much.
Thank you for tuning in to this week's episode of Surgeon Interrupted. If you enjoyed this episode, please rate, subscribe, and leave us a review. Check out hippocratic-collective.com for more shows and content just like this. We can't wait to see you back here next week. And in the meantime, remember, people are going to talk either way. Give them something good to talk about.
Thank you so much.